Mental health affects so many aspects of our daily life. How you think, how you feel, how you handle stress and relate to others, and how you make choices. You can see how having a mental health problem could make it harder to stick to your diabetes care plan. Our thoughts, feelings, beliefs, and attitude can affect how healthy our body is. Untreated mental health issue can make diabetes worse, and problems with diabetes can make mental health issue also worse. But fortunately, if one gets better, the other one tends to go better too. So in this episode, we're going to talk about mental health and diabetes and how you can use certain strategies to help you improve your overall health. Hi everyone, welcome back to Living a Balanced Life with Julio. On today's episode, we'll talk about mental health, mental stresses, and its impact on your diabetes management. If you're interested, please stay with me.
Exclusive.
Diabetes diagnosis can be a life-threatening event, whether it's type 1 diabetes where your body does not make any insulin at all, or type 2 diabetes when pancreas makes some insulin but not enough. This means that your blood sugar level will be high and will need medication, lifestyle management, and everything in your power to help control the management of your blood sugar levels. Complications from uncontrolled diabetes, including mental health complications, can be serious. When diabetes is uncontrolled, blood sugar or blood glucose level increase and can go to a dangerous level, a condition known as severe hypoglycemia. This occurs when, for various reasons, diabetes isn't properly managed. Consequences can arise from extreme hyperglycemia of having high blood sugars over a long period of time, where complication can start from eye disease, kidney disease, heart disease, and so forth. Being aware of uncontrolled diabetes complication can help people manage their diabetes and avoid mental health complications and physical problems. Controlling diabetes can be a very difficult task. While regular medical checkups are necessary as well as visit with other members of the diabetes management team, diabetes is a disease that is largely self-managed. Having diabetes demands constant treatment through vigilance, monitoring, adjustment, and action throughout the day, every day. So this can take a toll on a person's mental health and affect the way a person feels about having diabetes and the management of its complications. Medication is often needed for many people with diabetes, and lifestyle management, including proper diet, nutrition, exercise, self-care, must be followed carefully in order to avoid all the complications of diabetes and be able to manage it well. Proper diabetes management requires awareness of your symptoms. Just as you take insulin to ensure your blood sugar levels are within target, it's also important to make sure that you take measures to prevent mental health crisis by being aware of how you are feeling mentally and emotionally. Just like taking care of your body, taking care of your mind is equally as important to living a healthy life. When left untreated, mental health conditions like depression, anxiety can make diabetes worse. Likewise, existing diabetes can make mental health condition worse. So it's important, if you're diagnosed with diabetes, to take care of your whole body from head to toe, including your mental health. Diabetes can affect your mental health, and there's a big connection between diabetes and mental health. Diabetes diagnosis can feel like not just a threat to your health, it can also seem like a threat to your personal way of life, because managing diabetes means making changes to your day-to-day routine. Your doctor may instruct you to change your diet, your diabetes educators will instruct you to exercise, and there's a lot of changes that happens when a person is diagnosed with diabetes. Your doctor may tell you to avoid sugary beverages, restricting alcohol intake, which can be difficult for someone regardless of diabetes diagnosis. Adding additional responsibilities like tracking your blood glucose level, blood sugar level, and insulin can be hard to remember at first. Going for doctor's appointment, routine appointment can take time away from work, and this can cause extra burden on people's finances. These changes can be emotionally draining, and you might start to notice that you're feeling a bit off and have a little energy to deal or to carry on the important tasks of managing your health and your diabetes condition. People living with type 1 or type 2 diabetes are at increased risk of depression, anxiety, and eating disorders. Rates of depression across lifespan are 2 times greater for people with diabetes than in general population. People with type 1 diabetes are twice as likely to live with diagnosed eating disorders. Especially in women with type 1 diabetes, bulimia, which is an eating disorder, can lead to overeating and binge eating, which can affect your diabetes directly. Some of the symptoms that is associated with having blood sugar going up and down or fluctuating can be stressful on the person. Changes in blood sugar can cause rapid changes in mood and other mental symptoms such as fatigue, trouble thinking clearly, and anxiety. Having diabetes can cause a condition called diabetes distress, which shares some of the symptoms of depression, anxiety, and other mental stress. Unlike depression, diabetes distress can be linked back to causal factors related to diabetes. For example, fear of hypoglycemia or extreme low blood sugar level may cause significant worrying for some people. Diabetes distress can also be affected by external factors like family and social support and healthcare services. It is estimated that about 33 to 50% of people with diabetes will experience some kind of distress at some point in their life. While diabetes distress is not typically treated by medication, adding some lifestyle management to reduce stress, talk therapy, and support groups can be helpful in managing diabetes distress. Because when you're connecting with people that are experiencing the same thing, helps you realize that everybody that has diabetes goes through challenges, or any other chronic condition goes through challenges, and then you'll be able to share your experiences to help others, for others to help you to improve your overall health. Mental health conditions, just like diabetes, are treatable. Having both at the same time doesn't make either one less treatable. They just require different treatments. Ask your diabetes care team, if you have one, about a referral to a mental health care provider like a psychologist, psychiatrist, or any other therapist like social workers or mental health nurses to help you manage your mental health. Together, your doctor can help you find treatment plans that works for you and help improve your mind, body, and to be healthy as possible. Therapy is extremely helpful treatment option, and people with or without mental condition can benefit from it. Taking therapy is not focusing only on your problem, but it's also finding solution. Professionals can help you work through the many things that may be causing you stress and help you understand mental health conditions and identify ways and triggers that may worsen your condition, or coping skills that can help improve your condition. Common therapy types can include cognitive behavior therapy, family therapy, speaking to your healthcare providers like social workers, mental health nurses, speaking to your family doctor to make a referral to see a psychologist or psychiatrist. These are all ways of taking care of yourself, because when you have diabetes, you see a specialist to help you manage it. And when you have mental distress or mental stress or any mental condition, it's important to seek providers that are experts in that area that can provide you solutions to the problem. In addition to therapy, there are a number of different medications that can help you manage your mental illness and mental stress. When deciding on a mental health treatment plan involving medication, make sure you're talking to your healthcare providers about your family history of mental health and your known diabetic conditions. Some evidence suggests that antidepressants can help improve a person with type 2 diabetes depression and help improve some of the symptoms associated with it. It's important to seek the help when you need it. Please do not suffer in silence, because there's always resources that's out there that can help you manage your diabetes well and manage the stresses that comes with it. A diabetes diagnosis can cause prolonged stress, which may possibly cause an increase in your blood sugar. Stress can also make following your diabetes management routine more difficult. It's important that when you're taking care of yourself, you look at patterns and be aware of your stress levels. It is important to be mindful and look for patterns in your blood sugars. When your sugars are high, it could be the fact that your stress level is also high. So always, when you're looking at your blood sugar and logging your blood sugar, try to look at patterns to see if your blood sugar is high, because lately you've been going through a little bit more stress than usual. If you notice a pattern, you can learn to spot your stress warning signs and take action to prevent stress and keep your blood sugar levels at a target. This may mean that working with your professional, like your diabetes educator, your doctors, to help you learn relaxation and coping techniques. Just as diabetes therapy must be reviewed and adjusted frequently in order to find long-term solution to care. Finding the right mental health treatment can take time and be a long process, and the process could be a process of trial and error. Like many other chronic conditions, the sooner you get the help, the better your chance of getting the resources to help you manage the condition, prevent its complications that could be associated with it. So now that you know that having diabetes could cause a lot of stress on the body, let's look at some ways you can manage your diabetes and also manage your stress level. So number one, exercising. Physical activity helps to reduce stress by releasing some of the energy produced in the stress response. It also benefits for people with diabetes by increasing their body ability to manage insulin. So when you're exercising, you are using up the extra sugar that's sitting in your blood that's not being used, right? You're using that as energy. So the more exercise you do, the better your blood sugar becomes. And at the same time, because you're exercising, the act of exercise causes release of anti-stress hormones that can improve your mood and your mental health. And some of these hormones are dopamine, epinephrine, serotonin. These are all hormones that can help improve your mood and improve your mental health, and at the same time help improve your blood sugar as well. So exercise is very important. So making sure that you are trying to meet the target of 150 minutes of exercise, aerobic exercise per week, is a great way to help improve your mental health and also help you improve your blood sugar levels. Some of the tips that also help you improve your mood and your mental health is also having a positive attitude. Trying your best to laugh as much as you can, because laughter is like exercise for the brain. Right. So when you're laughing, the same hormones that are released when you are exercising are released when you laugh as well. So when you laugh, your body's releasing, I call them the feel-good hormones, which are epinephrine, dopamine, serotonin, and these are all the same type of anti-stress hormone that is released when you're exercising. So laughter is exercise for the brain. So even if you have to force yourself to laugh, just the act of laughing can improve your mood and can also help you with managing your blood sugar levels. Making sure that you're exercising, we talked about that, getting a good support system. So have people around you that can help you when you're going through any difficult time. Having a support system is very important, and your support system doesn't always have to be family. It could be friends, it could be your diabetes educator, your doctor, your healthcare team, because they're all there to support you to succeed, for you to prevent complications that could be associated with your diabetes and also the stresses that comes with it. Taking time for yourself is also important. So I know life happens and we're all very busy, but it's important to take time for yourself. Self-care is important. Meditating is another good way for you to help calm the mind and calm your nerves and calm your body, so you can prevent release of stress hormones in our body. Because whenever you're under stress, whether mental health stress or stress from taking care of your children, stress from work, stress from life, stress from illness, whatever it is, whenever you're under stress, your body releases chemicals or hormones that can cause your blood sugar level to increase, because essentially sugar is your energy, and whenever your body thinks you need that energy, it will give it to you through many processes in the body. So do your best to control your stress by meditating, taking time to read, listen to calming music, positive music, connecting with family, speaking to your healthcare providers when you're going through things to get resources that can help you manage. For many people, consuming a glass of alcohol here and there every day doesn't cause a problem. However, for those with health conditions such as diabetes, alcohol consumption can affect blood sugar levels and cause a lot of health risk for you. Drinking in moderation is the key when you have diabetes, or even when you don't have diabetes. Alcohol can interfere with your blood sugar levels. It can cause it to go extremely high at the beginning when you drink it because of the carbohydrate or the sugars in the alcohol, but later on it can drop your blood sugar dangerously low to a point where you can pass out, and we call that hypoglycemia. Excessive alcohol consumption can reduce the effectiveness of your insulin. So if you're someone that's managing your diabetes with insulin and you drink lots of alcohol, that can interfere with how the insulin is working. People with diabetes should try to skip drinking slowly and not drink on an empty stomach. So if you're going to have something to drink, have it around your meal time, so that way you have carbohydrate or you have some sugar from the food on board to prevent your blood sugar from going too low. So one of the best way to take care of yourself when you have diabetes, to make sure you're managing well, is to make sure that if you are someone that drinks, that you drink in moderation. If you're female, don't drink more than 9 drinks per week, or about 1 drink per day. And for male, no more than 14 drinks per week, which is equivalent about 1 to 2 drinks per day. If you find yourself drinking alcohol and excessive alcohol every time you're stressed, then it's important for you to speak to your healthcare provider and some family members that can help you deal with proper ways of managing your stress, because alcohol is not a stress relief. If anything, it's going to make your condition much worse. Making sure that you're getting enough rest or enough sleep is the best way to manage your stress. If you are stressed and you're not able to sleep, it's very important to speak to your healthcare providers to get you the resources that you need to help you to improve your sleep, because lack of sleep is considered a stress on the body. And when our body is stressed, glucose is released into our bloodstream to deal with the stress, and glucose is sugar. So decreased sleep is a risk factor for increased blood sugar levels. Even partial sleep deprivation over one night increases your insulin resistance. Insulin resistant is when your insulin is not working properly. Even though your body is making it, it's not working properly. And this can cause your blood sugar to go even higher. As a result, lack of sleep has been associated with diabetes and high blood sugar. So if you are someone with diabetes, it's very important that you get enough sleep. So making sure you're getting between 7 to 9 hours of sleep. And for children or teens, anywhere between 10 to 13 hours of sleep is recommended. If you're getting enough rest, then your body is able to heal itself, replenish energy, and then you're able to function and prevent blood sugar from going too high. Nutrition is a very important part of stress management. Just as stress can affect nutrition, nutrition can also affect stress. It's important that when you are under stress that you try your best to eat healthy, because healthy eating can prevent your chance of your blood sugar going up. It can help lower depression, anxiety, and stress. So it's important that when you're under stress, you eat healthy and avoid junk food, because eating foods that are high in sugar, high in salt, that are very processed, has very poor nutrition, and they will not be able to nourish the body the way it's supposed to. So when you're under stress, do your best to make sure that you are eating as healthy as you can, sticking with whole foods, sticking with high fiber foods, because these are the type of foods that can help boost your immune system, reduce inflammation in the body, and in turn improve your blood sugar and overall health. So for people with diabetes, stress management isn't just about finding ways to relax, it's also about managing blood glucose level. Your body makes stress hormones when under stress, and these stress hormones can make your blood sugar go up, making your diabetes harder to manage. Diabetes can impact your mental health, and your mental health can impact your diabetes. So as a person with diabetes, try your best to make sure you're connecting with your healthcare team, with family, to socialize, making sure that you're getting the help that you need out there, the resources that's out there to help you manage your stress, to prevent complications that could be associated with diabetes. It's not easy, but it is manageable. So do your best. Connect with your healthcare providers. Connect with your diabetes educators. They can help you with resources. If you're going through mental stress where you're not able to manage it or handle it, speak to your healthcare provider. They'll refer you to see a social worker, a psychologist, a psychiatrist, all of who have resources and techniques that can help you manage your stress properly, so you can then be able to take care of your diabetes and be in control of your health. So until next time, take care of yourself, be in charge of your health, seek help if you need it, and make sure that you are doing everything you can to control your blood sugar level by controlling your stress level. Take care and stay safe. Bye-bye.